I really don't know what the doctors injected me with. I have no idea.
To this day, we don't really know. It could be silicone, it could be cement.
I've heard stuff they buy at Home Depot, anything really. I can feel everything moving around in my body. At this point, I can feel all the substance moving down towards my legs. I want to ask Dr. Phil what is in my butt.
You know, one thing I think is so very important is awareness about what all of our rights are as patients when we go to a doctor. You know, when I was doing work in the litigation arena, I created a witness bill of rights and teaching witnesses what their rights were on the stand. And I say the same thing about patients. Patients have a bill of rights. And included in that bill of rights is the right to ask questions and get answers. Sometimes medicine has become a high volume business and you feel rushed, you feel hurried, like you're being a nuisance if you ask questions, like you have a stopwatch on you and you got to get out of there in a hurry. That's pressure you're putting on yourself. If somebody's getting ready to treat you for an illness that's serious enough that you went to a doctor, and certainly if they're getting ready to cut on you, perform a procedure, put something in or take something out, you have the right, you have the responsibility to slow down, sit down, and understand everything there is to know about that procedure. And these risks that are involved, these side effects, we sign those off like, oh yeah, that happens to other people. You need to take that seriously because it does happen. That's the reason it's on that list, and it can happen to you. You have to think of the risk-reward ratio. Are the risk worth the potential downside? I mean, you have children.
Yes.
Is the risk for you changing the way you look from behind, is the risk worth those children losing their mother?
Well, not put in that light, but I believe that I would pick a good surgeon and do my research and have trust in who I choose to.
But you understand the mortality rate for this procedure with an accredited surgeon is 10 to 20 times higher than other aesthetic surgeries.
Yes, I know.
Do you know that they had to literally cut my tissue out of me? I have holes in my body. So I have no choice. I have to go back because it's pulling like the skin and causing pain. They told me I was gonna have to redo it. This has been a year process. I'm going into 2 years with this. So I have to go have a reconstructive surgery that I'm supposed to do next week. I'm devastated, like scared, terrified. You know what I'm saying? But I have to do it. I have holes in me.
And this is traveling down your legs now, right?
Yeah.
The silicone is traveling down your legs.
You'll never get it out of your body, all of it. They told me the older I get, it'll go to the bottom of my feet.
Oh.
I mean, once it goes wrong, it doesn't go kind of wrong.
I fought for my life. Like I had 6 surgeries and 2 blood transfusions in like 3 months.
Wow.
About a butt.
Right, right.
Come on.
Yeah,
I just wanted to be the best version of myself.
Yeah, and the best version of yourself is alive.
Sure.
So read that stuff, ask those questions, get that information. There is no procedure that is without risk, and you can become a statistic in a hurry. Be informed, ask the questions, get the answers, and don't feel like you're a nuisance because you're asking the questions. My advice, write them down before you go in there so you don't freeze up under pressure. Have your list of questions, pull them out, and say, okay, doc, here's what I need to know, and I'm going to take notes on your answer. You have the right, use the time.